President Trump's former Surgeon General is criticizing Robert F. Kennedy's decision to cancel nearly $500 million in contracts to develop mRNA vaccines against future viral threats. Jerome Adams, who served during Donald Trump's first term, posted to social media, writing in part this: "I've tried to be objective and non-alarmist in response to current HHS actions, but quite frankly, this move is going to cost lives." Other public health experts are also sounding the alarm. The head of the Center for Infectious Disease Research and Policy at the University of Minnesota told NPR, "This may be the most dangerous public health judgment that I've seen in my 50 years in this business." Let's bring in right now NBC News medical contributor Dr. Vin Gupta. And Dr. Gupta, we want to get your take on Kennedy's explanation for these cuts. Let's take a look at what he said earlier this week.
mRNA vaccines don't perform well against viruses that infect the upper respiratory tract. One mutation and the vaccine becomes ineffective. This dynamic drives a phenomenon called antigenic shift, meaning that the vaccine paradoxically encourages new mutations and can actually prolong pandemics. To replace the troubled mRNA programs, we're prioritizing the development of safer, broader vaccine strategies, like whole virus vaccines and novel platforms that don't collapse when viruses mutate.
Dr. Gupta, your reaction to what Secretary Kennedy said and whether you find any evidence that, in fact, the approach that he's suggesting would be better in the long term?
Well, Joe, good morning. Let's take his first statement on what the vaccine does in the body. So-called, it doesn't work, to use his words, it doesn't work against preventing infection of the upper respiratory tract. To some extent, either he was misinformed by his team or he's just speaking in the wrong terms. But words matter, especially if you're the head of the Health and Human Services Division of the federal government. That's not what these vaccines, Joe, are meant to do. They're meant to protect and really arm up the immune system in the lower respiratory tract, which is our lungs. Upper respiratory tract is our throat, our nasopharynx, our nose. That's not what these vaccines have been. We've been talking about this for 5 years. These vaccines have been meant to prevent severe pneumonia, severe disease. They're meant to prime the immune system, primarily in our lungs, where we have a lot of immune cells, less so in our upper respiratory tract. So to some degree, he's accurate in saying, yes, these vaccines are not effective in preventing infection of the upper respiratory tract, but they're precisely not meant to do that. They're meant to really reinforce immunity in the lower respiratory tract. On the second point, this whole cell, whole vaccine platform, Joe, this has existed for decades, by the way. We do this for pertussis, we do this for influenza, other disease conditions. This is the reason. It's not a favored approach. It's less effective. It actually causes more side effects when you use that approach. And it takes 10 to 15 years to develop, which is why something like mRNA, less side effects, takes months to develop, makes a lot more sense in this era of pandemic threats.
Dr. Gupta, when you get to the premise of public health, obviously there's an implication there that this is about communication with the public and not merely an establishing of what is true and accurate about scientific fact. What is the biggest challenge right now when it comes to actually breaking through to a population that maybe isn't versed in any of the terms that you just described, even though you very clearly described them?
Yeah, I mean, Pablo, you're spot on here. I think the problem here is that traditional entities that operate in evidence and fact are not nimble and quick on their feet on social media. So it's very easy to create a narrative on social that's inflammatory, that's controversial, and that's the currency of information today. And so that's number one. It's just what actually gains traction is how controversial can you be and how against the grain can you be. Number two, there's just fundamental mistruths. I know we're going to talk about this shortly, but they want to maintain mRNA technology for, say, cancer research, Pablo. They don't want to do it for COVID and flu. But why is it okay for cancer research and not okay for infectious disease? All the fundamental mistruths about mRNA technology are that somehow it's altering your genetic profile. It's altering your cells and your genes at your cellular level. How is that somehow not happening in one instance, but it's occurring in another? They're not internally consistent. But these arguments don't matter, to your point, because it's easy to create a narrative.
Well, the Health and Human Services Secretary makes the move away from mRNA vaccine development. One research team is reporting promising new findings using that technology in a study to treat cancer. Joining us now is the founder of the Medulloblastoma Initiative, Fernando Goldsztein. The MBI, which funded that cancer study using mRNA vaccines, is a nonprofit organization focused on medical research for rare diseases. Welcome, Don.
Thank you, Molly. Thank you for having me here.
So tell us the importance of what you guys do. And these vaccines are sort of the cutting edge of possible cancer treatment. So what do they do, and what could we be losing with these cuts?
Yeah, actually, MBI is an initiative that I created. By the way, I'm not a doctor or scientist. I am a father. So my son was diagnosed with medulloblastoma 10 years ago. And back then I realized that kids with brain tumors were left behind because, believe it or not, the treatment for medulloblastoma and other pediatric brain cancers are from the 80s, so the time that we didn't have cell phones. So the kids are still submitted to this treatment, very toxic, and some kids relapse, and if they relapse, there is no cure. So I was told by the doctors that my son was going to die, there was nothing to do. I didn't accept that. Giving up on him was not an option. And then I created MBI, and we are approaching we have many approaches. One of them is mRNA vaccine.
You know, I'm looking at the lapel of your jacket, and you have your pin that says MBI in big block letters.
Yes.
I'm looking at the research file in front of me, and your son is now 18 years old.
Yes.
So this is a success story to celebrate on one level, and yet, when you were watching the news and you're observing what's happening, can you speak to the actual consequences and costs that people may not realize? Because we're looking at photos of your wonderful family here. This is a human story.
Yes.
How do you convey the human cost of what's being proposed?
Yes, I mean, by the way, I think it's important to say that once the kids relapse, there's no cure. So my son is an outlier, but we know that his tumor will come back. So MBI is about finding a cure for him and for thousands of other kids. And we think that RNA would be a very good option because it has been having good results on preclinical trials. And as the doctor here was saying about narratives, I mean, for cancer, it's not about vaccinating all the population. I mean, you are going to treat patients who have active cancer to prevent the cancer to come back or to treat. For example, my son has cancer. So, but is stable for now. But RNA, he does not respond to the treatments, the current treatment. So RNA might be the way to save his life. So I mean, I think of course we should not cut these funds for RNA because it's the future.
Dr. Gupta, if you would, please jump in on that point.
Yeah, Joe, thank you. Fernando, first of all, thank you for all that you're doing with MBI and bringing attention to this. I was wondering if you could explain to our viewers what exactly mRNA vaccines for cancer, what do they do and how do they do it? Because most people that have been afflicted by cancer think about chemotherapy, multiple regimens, terrible side effects, and it's not pleasant. And to your point, there's a lot of treatment resistance out there. What's different about this mRNA technology for cancer?
What's the difference for cancer? Yeah, because you are going to when you do a chemotherapy, you are going to be very aggressive to all the cells, the bad cells and the cancer cells and the good cells. And with RNA, you can give a very personalized treatment, so it's not one size fits all like chemotherapy. I mean, as I was mentioning in the beginning, the treatment is very aggressive. I mean, if you see it's very sad to see a kid suffering from cancer and being treated with such as aggressive treatments, as I said, from the 80s. So that's why we brought together this group. It's 17 institutions from United States, Canada, and Germany. So it's a unique model. So they have to work together to be funded. They have to have full collaboration, full transparency, no silos, no duplicate work, and an extraordinary sense of urgency, because we want to save my son and thousands of other kids. And we were able to approve 2 clinical trials already. So even though we have 3 years old only, we approved 2 clinical trials, and we are treating kids already in the University of Florida, not with the RNA vaccine yet, but with another treatment. So I'm used to say that we are going to find the cure of this disease. It's not a matter of if, but it's a matter of when we will do it.
It is such hopeful news. Fernando Goldsztein, thank you so much. And NBC News medical contributor, Dr. Vin Gupta, we thank you as always. And when we come back,